A very warm welcome to you all from Karachi, Pakistan. It's, I guess, almost more than 35 degrees over here. So this welcome is really warm. And we're going to start in the next 2 minutes. Could you all please write your names in the chat boxes so that we know that you're here and you've registered yourself? So we're going to have a 1-hour session on introduction to protocol writing. And in this session, I'm going to just come to the objectives of this session. Hello, Dr. Aslan, Dr. Sana. That will be, I guess, that should have been the last slide. That's actually the take home of today's session. The more I learn, the more I realize how much I don't know. And that is what has happened to me after, every milestone I have achieved, after every degree and diploma I have taken. I have just realized how much I don't know. And research is a way to find out more and more what you want to know, what you need to know, and what is best for your customers, for your patients, whoever you provide service to. So let's start today's session. Again, a hello to all those who have just joined. So why do you need to publish research? A lot of you might be just basic researchers, or you would like to start your own research project. You would like to write your own research protocol. Why do you actually are thinking of writing something? You might want to say something important, right? So you've discovered something new and you want to discuss it. You want to tell the world about it. You want to share your work. You might have come up with a new, for example, a new surgical technique. You might have come up with a new invention in terms of diagnostics, in terms of therapeutics. So it could be anything, any new thing which you want to share with the world to change practice. So you might have observed, if you're a clinician or if you are from the medicine and allied faculty, if you're from, for example, nursing or a physiotherapist, you might have observed something in your practice which works or which is not working. And you might want to tell the world about it, that you've tried something new, or this is something which is very unique about your patients and particularly your part of the world. And you would like others to know about it so that, you could generalize it at least to your local setting. Then you could promote a thought or a debate. So you might want to write, for example, comment to an article. You might want to write a letter to the editor. You might want to make a short commentary about something. You might want to write a review article. You might want to review literature about a specific therapeutic or a diagnostic intervention. So, you have so many ways of putting your observations forward, and publication is one of those. You might want to educate other people. Now, that's where, this is business. So you might want to get into high impact factor journals. You might want to get a promotion. So it might be a mandatory requirement of your university or your institution to get more publications so that you could be promoted. That is an enough incentive to publish, I guess. And you want to keep your job, because if you don't, then you don't get promoted and the other person gets promoted and you might, lose your job eventually. So, and you want to make money. So as a principal investigator, you might want to actually get into projects, do something new, and then make business for yourself as well. So these are all the incentives you could get if you are sort of thinking of publishing your own research. So you can always interact with me on the chat box. I'm going to answer each of your questions. Any questions you would like to ask, please go ahead and ask me in your chat box. I'm going to answer it right away. So as we're going to move on one by one steps of protocol writing, you might have a lot of questions in your mind. Please come up with it. If I ask a question, you can answer in the chat box. I'm sorry, I would not be able to unmute you. The reason is that if I unmute you, it might create, some internet issues at your end or at our end, and it is going to waste a lot of time. So please write anything you would like to in the chat box. So how do you come up with a publication? So these are steps of publishing in a scientific journal. First of all, you need to come up with a broad research question, right? So you need, that can come out of practice, out of observation, out of literature search. So we're going to talk about it, right? So you need to then look it up in the literature, what is already known about that particular topic. So we're going to discuss quite a few sort of topics which you could tell me or I could tell you. I'm not sure about your specialities, but you could come up with any random topic from your own specialty and write it in the chat box and say that I want to talk about this topic, right? So I can talk something, at least something about that topic. And then you need to write objectives, which should be measurable. We're going to talk about how to write objectives. Eventually, you have to design a research protocol, a complete plan of a research methodology. And then you need to get an IRC, which is an institutional review board or institutional review committee or ethical review committee. It's called, it has different names in different institutions. So you need to get an approval from ERC, which is mandatory. Why is it mandatory? Because they are going to review your protocol in terms of if it it's according to the ethical guidelines of your particular local setting or your institution. And you need that number, that ERC approval number, to publish in any scientific journal. So if you don't have that ERC number, any scientific journal will not take your article and they will not publish it, right? So you need to keep that in mind. Then you collect data. So after an ERC approval, you can collect data. Then you analyze and interpret results. Then you write a manuscript, as in you write an original article, original research article. And finally, you send it to a journal so that that journal can accept it, or they can suggest you some modifications to it. They can give you some suggestions and you could improve on your manuscript. And finally, you can publish it in a good quality scientific journal. So these are all these steps. Now you see that to publish a manuscript, the major steps I would say are to come up with a plan. Unless you have a plan for your manuscript or your research, you cannot just start research from anywhere without a plan. You will not be able to come up with a good quality research protocol if you do not plan your study before collecting data. It is very, very important. Even if you have a lot of data in your institution, in your department, even then you have to come up with a plan to publish that data. Only then you should be picking those data and publish it, right? And you need an ERC approval for any study you would want to publish in a scientific journal. Yes is not. ERC is Ethical Review Committee. IRB is Institutional Review Board. It's almost one and the same thing. For different institutions, they would call it with different names. So it's just the same, right? So yes, you can keep on asking me questions in the chat box, and I'm going to try to answer as many questions as possible. So the step one to protocol writing is formulating a research question and hypothesis testing, right? So you need to now come up with a research question to be able to answer it. And where does that research question come from? It comes from your practice, from your day-to-day, maybe if you're seeing patients, if you are a nurse, an allied personnel, a LHV, or a physiotherapist, or a doctor, whichever field you're in, you're a surgeon. So whatever you are practicing, you get questions in your mind while practicing, and you would want to go back and see if you have enough literature on it already, so that you can just get your answer from the literature. Or if you don't have enough literature on it, then you need to explore. Dr. Uzma, you cannot hear my voice. Can the other people hear my voice? Can you please write in your chat boxes if everybody can hear my voice and see the screen as well? Because, there might be a problem at your end, Dr. Uzma, because the other people can hear my voice. Right. So what is a research question like? How is an ideal research question like? It should be ethical. Of course, it has to be ethical. it has to be specific. So it should not be very, very vague. It should be very sort of focused, and you're answering a specific question which you've observed in your practice, or you would like to answer. It should be novel. It should not be something which has already been answered. It should not be something on which there's a lot of literature already there. What's the purpose of wasting your energy and time on something which is already there in the literature and you find everything about it on internet, right? So you don't want to waste your time on it. It should be feasible. Like, you need to come up with a practical sort of a question which you would be able to answer in the specific time period you need to. You might be wanting to write it for your dissertation, for your master's thesis, or something like that, and you have a very short time in which you need to collect data and write the protocol, as well as write the manuscript and publish it, right? So it should be practical and feasible. It should be relevant to your practice. So it should be relevant to your specialty. It should be relevant to your local setting, so that it can be generalizable to where you are practicing. And finally, it should be answerable. It should not be something which is sort of very, very over ambitious. And at the end of the day, you just realize that you are unable to answer that question. So, these are very important aspects of a good research question. So you need to rationalize your research question. When you come up with a question, you need to search literature. You need to find out that if there is already a lot of data on it, and then you need to come up with the gaps. So what is known and what is not known about that specific topic, and what is unknown is more important for any new reader than what is already known. So you would want to work on a gap, on something which is not known, some knowledge which is not readily available. So you would want to work on some knowledge which is not readily available, rather than just duplicating a question which has already been answered in the past. Right? And then you write an introduction to your topic. So what does an introduction look like? The introduction looks like that the first thing which you would like to write in your introduction is introduce the topic. For example, you're writing about an intervention in COVID pneumonia, right? So you're proposing a new drug for COVID pneumonia. So you need to write what is already known about therapeutic interventions in COVID pneumonia. So what are the sort of antivirals or steroids which are already been shown to be effective? So, you need to write the background of the topic. So about the therapeutics in COVID. Then you need to write about what is already available in literature. How many studies have been done, the studies which have proven certain medications to be beneficial in COVID. So you need to write about that, international literature, as well as if you have local literature on it as well. Then you need to identify gaps in the literature. For example, you might say that, the antiviral works if given within 10 days of COVID pneumonia. Of start of symptoms or COVID pneumonia. So you would like to explore if there is an if there is another drug which can work after 10 days, right? So you need to identify gaps in the literature and talk about it. And from gaps in the literature, you come up with a rationale of the study as to why you're trying to do this study and how will the study help other people to improve their practice. And then the objective. So you might want to see simply a frequency. It's not necessary that all the time you're seeing, efficacy of a therapeutic intervention or a diagnostic intervention. It might be that you just want to see prevalence of a certain disease in your part of the world, which is not already known. So let's see how you could do it. So you need to write the objectives, right? So what are you trying to do? And then after writing the objectives, you come up with the title of your proposal or the title of your synopsis. There are primary objectives and there are secondary objectives. And the objectives should be SMART, as they say, SMART. So SMART means it should be specific, It should be measurable, just like your research question. So objectives are just like your research question. It should be specific. It should be measurable. It should be something which is attainable, which is feasible. It should be relevant, and it should be time bound. So it should not be something which, you continue to do for so many years, and then, you lost to follow up, all the patients lost to follow up. And at the end of the day, you're left with nothing, and you don't have enough data to publish, right? So you have to be very practical about, what are your local limitations, and, how much feasible is the question for you to answer. Dr. Sana, if you can write your question in the chat box, I would appreciate that. I've already suggested to write your questions in your chat box, and I'll continue to answer those questions. So let's come up with, a primary objective and a secondary objective as well. So for example, this is a study, and the primary objective I've written is to determine frequency of neuropathy among newly diagnosed diabetic patients in South Asia, right? So to determine frequency of neuropathy among newly diagnosed diabetic patients in South Asia. Can somebody come up with a secondary objective from this study? Can somebody come up with a secondary objective from the study? So the primary objective I've already written, to determine frequency of neuropathy among, which is a complication of diabetes, among newly diagnosed diabetic patients in South Asia. Can somebody come up with a secondary objective? If you can, Dr. Musa is saying, is it age specific? Well, that would be covered in the primary objective only. Okay, so Dr. Muhammad Salim is suggesting we could write the risk of amputation. Yes, so you might want to see with neuropathy, you might want to see retinopathy as well. You might want to see diabetic foot as well. So you might want to see other complications frequency as well. Males and females, Galaxy Note 9, if you can please write your name. Who are you? So gender would be seen in frequency. So when you're talking about frequency, the socio-demographic factors would come automatically in, right? Diabetic control. Okay, so you would want to see probably the risk factors associated with neuropathy in diabetes, maybe. So that's what I have written as well, to assess the risk factors associated with neuropathy among newly diagnosed patients in South Asia. So you might want to see other complications as well, or you might want to see associated factors of patients having neuropathy with diabetes, right? And yes, of course, Fatma, you can look at the quality of life of such patients. That could be a secondary objective. You can look at the mental health of such patients, how much pain these patients have, how much these patients are suffering. You could see so many things in secondary objective. Dr. Salim, you're asking me what is the difference between rationale and objectives. So objectives is something measurable. What do you intend to do, right? What are you trying to do? And rationale is why you are doing it, right? Why do you want to do this study? What difference would you be able to make if you do this study and publish the results? You understand the difference, right? Okay, so objectives. And then what do you think should be the title now? You've already seen the objectives. So what do you think should be the title of this study? If I try to give a title to this study, what should be a title to this study? If you can tell me. How about the title? If you can give me a catchy title, which is very specific to the objectives. We need to have a title which matches the objective, which should not be different from objectives. How neuropathy affects diabetics. Dr. Musa, that doesn't match with the objective. Something which should absolutely match with the objectives. So let me give you a few ideas. Diabetic neuropathy and risk factors. Even then, Dr. Sadaf, we are looking at neuropathy in newly diagnosed diabetes, right? So newly diagnosed diabetics are very important. This is the patient population, right? Dr. Wahidullah is saying prevalence of neuropathy in newly diagnosed diabetic patients. But Dr. Wahidullah, what about the secondary objective? That does not reflect in your title. Your title only speaks about the prevalence and not the risk factors. So it's probably an incomplete title. Incidence of neuropathy in newly diagnosed diabetics, Dr. Amit, that's a very good idea. But again, that does not speak about the risk factors. Understanding diabetic neuropathy. So Fatma, you would use such a title in a review article, not in an original article. You're trying to understand. Now, understanding is not measurable. So your objectives, your title should be something which is measurable. Understanding is a very vague term, right? You will not be able to measure it. Neuropathy as a presenting symptom of diabetes. Yes, that's a very good thought. I think that's good enough. So it should reflect the objective of the study. It is written after the whole protocol and it is true representative of the plan. So let's see what I have come up with. Diabetic neuropathy among newly diagnosed diabetics in South Asia, right? So this is one. The other is frequency and risk factors of diabetic neuropathy among newly diagnosed diabetics in South Asia, right? And the third one I have come up with, diabetic neuropathy among newly diagnosed diabetics, frequency and risk factors, right? Do you think this makes sense? All these three titles make sense now? Do you understand my point? How objectives should match the title? Do you get my point? So all these three titles are good enough, right? And then you start planning the methodology. So once you've come up with the objectives, now you try to find out a plan to execute your study, to execute the objectives which you have come up with. You need to now write the operational definitions. You need to come up with a study design. You need to know the setting and study duration, the inclusion and exclusion criteria, the sample size, the ethical considerations, the sampling technique, the data collection tools, and how will you analyze the data. So this is the complete plan of the study. Dr. Mohammed Salim is asking, is it necessary to write secondary objectives? Not really. If your primary objective is good enough, you don't need to write secondary objective. But you see, if you're just looking at the prevalence of neuropathy, that is probably not enough to publish a whole article. You need something more into it to talk about, right? So just one prevalence will not be enough. So if your primary objective is enough, go ahead and work for it. But if you think that the primary objective will not make a complete article out of these study, then you need to explore more and come up with some secondary objectives as well. So operational definitions. What are operational definitions? This is the definition of the exposure. Exposure is the risk factor, and outcome variable. Outcome is the outcome or the dependent variable of interest and its means of measurement. Now let's see that how you write an operational definition for the same objective I was talking about. So it is in context to the objective in a particular study. So which one do you think is a correct operational definition for the current study which I was talking about? To determine the frequency and risk factors of neuropathy among newly diagnosed diabetics in South Asia. What is the correct operational definition of diabetes here? Galaxy, I forgot your name. Could you please write your name so that I can address you through your name? Dr. Anjum says E and Dr. Musa says B. What about the others? Can you tell me which is the best operational definition in this particular study? Okay, so quite a few are saying A, somebody said C, somebody said B. So you see, operational definitions should be specific for your study. It's not a dictionary or a Google definition. It's not, for example, the last definition is from IDF, International Diabetes Federation. So that's the standard definition. But for your operational definitions, you do not want to write the standard definitions, but what you are doing in your own study. So yes, people who are saying A are right. Fasting blood sugar more than 125 or HbA1c more than 6.5, detecting among those screened with diabetes with no prior history of diabetes and not on oral hypoglycemics or not on any hypoglycemic drugs, right? So that is the best operational definition for your own study. Remember, for your own study. We are not talking about definitions. We are talking about operational definitions, which means that definitions you are going to use to diagnose patients in your own study, right? So let's see what would be, so that's the right answer. What about neuropathy? Which one do you think is the correct definition of neuropathy for your study? Yes, Carlos, you're right. Are you talking about this one or are you talking about the previous one? What about this one? Which one do you think is the correct definition of neuropathy for this particular study here? So somebody's saying A, somebody's saying B. Again, I must tell you, it's not a standard definition. It's something which you're doing in your study, right? So what are you doing in your study here? Exactly, measurable, right? It should be measurable. So operational definition is how would you measure that particular characteristic? Still some people are writing A and some people are writing B. Again, I must tell you, it should be measurable. It should be measurable. Try to think again. Dr. Hadi, it should be measurable. Is A measurable? Could you measure it in terms of, do you understand how are you doing it? No, that's the standard definition. The answer is B. Unilateral or bilateral reduced vibration through a tuning fork, proprioception in the big toe, and through monofilament fine touch, right? So that's the operational definition. That should be measurable. What are you going to do in your own study? Let's look at the study designs. So study designs are basically divided broadly into observational studies and experimental studies. The basic difference between observational and experimental studies is that the principal investigator is intervening in experimental studies, while in observational studies, the principal investigator or the researcher just stands and observes, right? He just observes. He gives you a questionnaire, you fill up the questionnaire, and he just observes data. If he's intervening, sort of he's deciding what you should be getting, what tests you should be getting, what intervention you should be getting, whether you should be treated or not treated. If he is deciding that, then it's an experimental study. So Dr. Amreen is asking, from where do we extract operational definition? You have to make it yourself for your own study, right? Based on the knowledge you already have, right? So these are the two different types of study designs. I'm not going to go into the detail of each study design because, you know, I need maybe an hour or two to talk about each of these study designs and, you know, tell you the pros and cons of it. But this is just, you know, a basic demarcation, observational study and experimental study. So if you talk about the randomized controlled trials, those are experimental studies. And then you have a meta-analysis. Meta-analysis is just, you know, analysis of various studies already done in the past. So meta-analysis is not actually doing your own research trial or research study, but analyzing data from various studies and coming up with a consensus, you know, coming up with one sort of result to all those studies which have been done already. So that's a meta-analysis, right? And it also has a lot of importance and you can publish it as an original research as well. Yes, Dr. Rahila has commented that literature review also helps for operational definitions. That is absolutely right. Yes. So let's see, you know, if you know your study designs, or you can at least guess it. To determine frequency of neuropathy among newly diagnosed diabetic patients in South Asia. So which of the study design is the most appropriate for this? What do you all think? Review article and meta-analysis, Dr. Ahmed, are not the same. Review article is just a review of already known literature. Meta-analysis is a technique to analyze multiple studies at the same time. It's an analysis. review article is just a narration. It's just a sort of a summary or discussion, right? Rather than analysis. So people are saying cross-sectional, some people are saying C, randomized control trial, frequency of neuropathy. So you are not intervening, right? You're just observing the frequency. You're not doing anything, you're just observing. So this is an observational study, and this is a survey, or if you look at the definition of a survey, it fits into a cross-sectional study. So cross-sectional study or a survey is the same thing. To determine frequency, you cannot do a case control study. You cannot do a retrospective cohort. To determine frequency, you can only do a cross-sectional study. And Dr. Isna, there's nothing like a prospective cross-sectional study. So forget about adding prospective to cross-sectional. Cross-sectional is a study at one point in time. It's not prospective. Prospective can be a cohort study. A cross-sectional study is just one snapshot in time, right? You might want to do it over 3 months, over 6 months, but it's still a snapshot, right? It's not a prospective cohort. So prospective cohort is a different study, and cross-sectional is different. Retrospective is, you start backward. You look at the records. So if you have medical records, you look at the records, that's more likely to be a retrospective study. So this is a cross-sectional study. So what about this? Neuropathy as a complication of COVID-19. So you might have observed neuropathy in a few or maybe 1 or 2 of your patients after COVID-19, and now you would like to tell the world about it, right? So this is something which is probably rare or very rare. So it's something which initially when COVID was being reported, it would have been very, very rare. It maybe somebody reported it for the first time. So what do you think? So it's not a retrospective cohort, it's a case report. This is a case report because it's something which is a very rare possibility, something which occurs once in, somebody's lifetime. Or as a clinician, if you've seen something for the first time, you go back to the literature and you see that it has been reported just one or maybe a couple of times in the past. Now you would like to again report it, that you've again seen something which was very rare, right? So it's more likely to be a case report than anything else. How about this one? To compare risk factors associated with neuropathy among diabetics. What about this? So you're now looking at associated risk factors of neuropathy among diabetics. So what do you think? Yes, Dr. Khwaja says case control. Dr. Zubia says cross-sectional. Dr. Mariam says RCT. RCT is very, very specific to an intervention. There has to be an intervention somewhere to say this is an RCT, right? So most of the people now are saying A. So the answer is A. A case control study is basically done to look at multiple risk factors for one study, right? So if you're looking at the risk factors of neuropathy, so your cases would be people who have neuropathy among diabetics, and your controls would be people who do not have neuropathy among diabetics. And you would compare both of these groups in terms of their risk factors. So how are the sugars of patients who have neuropathy with diabetes, and how are the sugars of patients who do not have neuropathy with diabetes? Then, you may want to look at their lipid levels. You may want to look at their quality of life. You may want to look at, their socio-demographics, and all these would be risk factors. And you would like to determine which is more in which group, right? So that's a case control study. Now, what is this? Dr. Zubia, we are not even halfway through the session and you're worried about the recording of this session. So we're going to give you the recording, don't worry about it. Efficacy of duloxetine versus pregabalin among diabetic patients with neuropathy. So what do you think? What kind of study design is this? Yes, Isna. Now, This is a randomized control trial. You see how specific it is. This is not a case control study. This is a randomized control trial in which you're trying to look at two different interventions in terms of how it improves neuropathy symptoms among, diabetics. So the answer is RCT. So what about this? Weight changes among diabetic patients on metformin only versus empagliflozin only among newly diagnosed diabetics. So you are looking at weight changes with metformin as a sole therapy versus EMPA as a sole therapy. So what do you think? Now, everybody is saying randomized control trial here. Somebody is saying case control. Somebody says cohort. So people who are saying cohort, Dr. Uzma, Dr. Amir, Dr. Javed, why are you saying cohort study and why not RCT? Why do you think it should be a cohort study and not RCT? So a cohort study is an observational study and a RCT is a interventional study. Yes, Muniba, I'm sure you're unable to pick up from examples. The reason is that, as I said, that study design is itself a very vast topic. It has to be sort of dealt in 2 hours, right? So I am trying that you have some idea about it, but I'm going to tell you how you could join, the complete course if you like to. Right, Dr. Wali, you're going to get the recording of it, so you can easily, sort of get the slides also. And we're also going to share the answers of the pre-test we sent you, so you can also have some idea from that as well. So why nobody told me that why this should be a cohort and not randomized controlled trial. I think people who are already endocrinologists or who are internists or physicians who have been dealing with diabetes would know the answer. Basically, metformin is always the first choice of medicine in diabetics, right? So if metformin through the guidelines is always the first choice of medicine, then don't you think it would be unethical if you choose to give EMPA in certain group of patients? Do you understand that point? If metformin is, the guideline says that metformin is the first choice of medicine in diabetes, then how can you start somebody on EMPA and not metformin and then look at the results? You cannot start somebody directly on EMPA without putting that patient on metformin. It's unethical, right? So there is an ethical issue with this study. You cannot do this, right? Nobody will allow you to do this. Do you get my point? Do you all get my point? If I say that the guidelines show that metformin has to be the first choice, then you cannot do a trial to see the difference between metformin and EMPA as a sole therapy, as the first therapy in diabetics. So this is unethical. What you could do is just observe. So you could do it as a prospective or a retrospective cohort among patients who are already getting it as a sole therapy. So there are certain physicians who have actually decided to start patients on EMPA. Now you can just observe this. You cannot decide who to give what. If the physician has already given them EMPA, then you can observe them. If the physician has already given them metformin as a first therapy, you can observe them, but you cannot decide who gets what. Do you understand that? So you need to do this as an observational study and not as an RCT. Then you need to document about the setting of your study. For example, if you're doing it in South Asian countries, then you need to have a sample from each of the South Asian country, from Pakistan, Bangladesh, Sri Lanka, India. So you need to have sample representative from each of these countries. If you're able to do that, go ahead, that would be great. If you can't do that, do it in your local setting, right? So just do it in your local setting and you could, sort of come up with it. You could collaborate for different studies. You could come up with data from your part of the world. And then, you could collaborate with other colleagues in other parts of the world and come up with one study, right? So setting, you should need to have a representative sample. Duration of the study, so that's how you make sort of this is a Gantt chart, but you could make it on a Microsoft Word or a PowerPoint. You could just add in a table, and you could just make a plan of the whole study as to you're going to write protocol, then when are you going to collect data, when are you going to start writing a manuscript, when are you going to send the study for publication, and publication at least takes 6 months, right? 6 months to maybe a year. So you need to plan your whole study like that. You need to come up with an appropriate sample size which answers the particular question you're trying to answer, right? And that is done through different softwares. So coming to the first objective we were talking about, to determine frequency of neuropathy among newly diagnosed diabetic patients in South Asia. What do you think should be the inclusion criteria for it? So which one is the correct option here in terms of what should be the inclusion criteria for this specific objective? Dr. Zakir, you have to calculate sample size in all these studies. Every study needs a sample size calculation, whatever the study design. So everybody is saying E. Somebody said D. So E is those who screen positive for diabetes and neuropathy without any previous history of diabetes. So a lot of people are saying E. So you're only going to choose those people who have diabetes and neuropathy. So if you only take those people who have diabetes and neuropathy, then what will be the prevalence of neuropathy in your study? Can you tell me? If you take all the patients who only have newly diagnosed diabetes and neuropathy, what will be the frequency of neuropathy in your study? What do you think? You've only chosen patients with diabetes and neuropathy. Answer me this question, please. Yes, Dr. Faiza is absolutely right. Dr. Faiza says that if you only take patients with diabetes and neuropathy in your study, then the prevalence of neuropathy in your study would be 100%. That's right. So is that the right inclusion criteria? That was a googly, right? All of you got confused. You cannot take only diabetics with neuropathy. Otherwise, you're going to have 100% prevalence of neuropathy. You would like to see neuropathy, prevalence of neuropathy. So you're going to take all the new diabetics, right? With or without neuropathy. You're going to take D, right? So D is the correct answer. See, it's all logical. It's nothing, it is technical, yes, but at the end of the day, it's logic as well. So once you're going to learn the techniques, it's going to be really easy for you all. So what would be the exclusion criteria for the same study? What do you think? Who should be excluded? People would usually write those who give consent are included, those who do not give consent are excluded. So exclusion criteria is not the negative of inclusion criteria, right? You need to write the exclusion criteria because through exclusion criteria, you control for the confounders. I'm not going to go into the detail of it, but if you're going to attend the session, you're going to further, understand what does bias and confounding means and how do you need to control for the confounders. So what do you think about this question? What's the answer? C. Dr. Isna says C. Dr. Hadi says A. Diabetics with known neuropathy. So are you trying to say B? No, A. Who are you going to exclude? Diabetic patients are already excluded, right? So diabetic patients are already excluded. Known diabetics. Known diabetics are already excluded. You're screening people for diabetes who do not have a history of diabetes, right? So the answer is C, known diabetic patients on diet control or hypoglycemic. So answer is C. You're going to exclude C, right? You're going to exclude all the known diabetics only on diet control or hypoglycemic, because you're screening for diabetes. You're trying to find out the incidence of neuropathy among newly diagnosed diabetes. So of course, you're going to exclude those who are known diabetics. Do you understand that? Dr. Hadi, if they are diabetics already known, they will be excluded, right? So only diabetes, only having diabetes is exclusion criteria. Okay, I'm sorry about the objective. I'm sorry about that. This objective, you're talking about the same objective. Actually, I copied this slide from another question. So that's why I'm sorry about this. If I can just remove it over here to not to cause any sort of confusion later on. Yeah, right? Okay, so sampling technique. So sampling technique is how you select a sample from a bigger population. So you can do it at your convenience. You know, you can take all the patients coming to you. You can do probability sampling, as in you could take every third patient, every fifth patient, that's systematic sampling. Or you could take a sample randomly, you know, so you could just take out a computer generated list, and that list gives you who to select and who to leave. But that's going to take a longer period of time. Dr. Sadaf, that was a wrong objective. That was a misprint there. So I've removed that, right? So probability sampling is when you know that each of your patient has a similar probability of getting selected. Convenience sampling is, you know, you could select whoever you like, you know, that patient seems to be more compliant, let's select this patient, or that patient would answer me, let's select this patient. Take all the patients, whoever comes to me, take all of them. This is convenience sampling, right? So there's different types of sampling techniques, probability and non-probability techniques. Then you would learn how to develop, and you need to learn how would you develop an online and a manual questionnaire. Questionnaire is also something very technical. You need to learn how to write questions and be specific about it. For example, if I ask somebody, do you have diabetes or hypertension, right? And the answer is yes and no. What is the problem with this question? Do you have diabetes or hypertension? What is the problem with this question? Dr. Zakir is asking, what if we retrieve data from medical records? That's convenience sampling, Dr. Zakir. That's also not probability sampling. Dr. Hadi is saying it's a bias question. How is it a bias question? So your question is, do you have diabetes or hypertension? That's two questions in one question. Yes. Dr. Zakir, is that you? So two questions in one question. You're asking about diabetes and hypertension in the same question, and then you're saying yes or no. What if the patient has diabetes and no hypertension? Or what if the patient has hypertension and no diabetes? Or what if the patient has both? How would you know? You will not know, right? So never ask two questions in one question. I'm just trying to tell you that even developing a questionnaire is a technical matter, and if you make errors, then you're not going to get appropriate data. If you analyze later, you're going to get erroneous results. So you need to understand the basics of data analysis. A lot of p-values you must have seen. You must have tried to understand a lot of p-values. Do you have the basic concept of what's a p-value? You must have seen a p-value less than 0.05 is significant. Do you have some idea of a p-value? What's a p-value? Or you just know that 0.05 and less is significant. probability of what, Dr. Faiza? What margin of error? Yes, now you talk. No, it's not the null hypothesis. So let me tell you what is a p-value. For example, if I am looking at the risk factors for neuropathy among newly diagnosed diabetics, and one of the risk factors I would say is obesity. So what would be my null hypothesis for this associated factor? What would be my null hypothesis for obesity as an associated factor of neuropathy with diabetics, among diabetics? What would be the null hypothesis here? The null hypothesis here would be there is no association of obesity with neuropathy among newly diagnosed diabetics, right? So my null hypothesis would be there is no association of obesity with neuropathy among newly diagnosed diabetics. And what would be the researcher's hypothesis? What do I want to prove? What am I trying to prove? If I'm the researcher, I'm trying to prove that obesity is associated with neuropathy, right? That is the alternative or the researcher's hypothesis. So I would like to say, or I would like to prove that there is an association of obesity with neuropathy, while the null hypothesis is that there is no association. Do you understand that point? Do you all understand that point? I would like to reject the null hypothesis, right? So whatever the null hypothesis is, I would like to reject it, and I want evidence against the null hypothesis. I need to collect evidence against the null hypothesis, and that is why I'm doing this study. And after this study, I should be able to say that obesity is associated with neuropathy among diabetics. Is that right? Do you all understand my point? Am I able to get onto your brains and understanding level? Right? So I need evidence for it. And that is why I need a certain sample size to prove that point, to find out evidence and to have adequate evidence against this null hypothesis. I need a certain sample size to prove this, right? And once I have evidence against it, I need to be sure that I am not making an error in saying this, that there is an association of obesity with neuropathy. So I have to be very, very sure in saying this, that there is an association. Is that right? So the p-value is basically the error, the possibility of error I can make in concluding this result. So if I conclude that there is an association of obesity with neuropathy, my p-value should be less than 0.05 or less than 5%. So my probability of error should be less than 5%. So a p-value of less than 0.05 is significant because my probability of making a mistake in concluding that obesity is associated with neuropathy is less than 5%. Do you understand my point? I know this is very technical, and if you're part of the course, we're going to go into more details of it and discuss it in a very, very sort of detailed way. But I'm just trying to make you understand just a simple p-value concept, which almost majority of us do not even understand, and we keep on saying p-values, significant values, this is significant, this is not significant. We have no idea that we are talking about evidence against the null hypothesis and the probability of us being wrong in concluding that, right? So I hope you understand that. So you don't calculate the possibility of making error, you just standardize the error, which is 0.05%. So p-value is always standard. right? So you have to standardize this p-value, that if my results show a p-value of less than 0.05, then only I would say that my results are significant. Otherwise, they would be insignificant in sort of rejecting the null hypothesis, right? So to reject the null hypothesis, you need enough evidence, and to have enough evidence against the null hypothesis, you have to be very sure and having less than 5% probability of being wrong. Is that right? Yes, that's the type 1 error, Dr. Javed. That's the type 1 error. Alpha or p-value is the type 1 error, right? So I'm only going to tell you about the type 1 error for now, because I understand that I cannot discuss all these things in just, the next 10 minutes. So ethical considerations, of course, as I've already talked to you about it, you have to be very careful in your write-up. You need not copy paste. If you're copy pasting from different articles, if you're trying to duplicate another article, that's very, very unethical. And I know that most of us do not even know that we are doing something wrong. A lot of us don't understand the value of, writing something in your own words, or giving your own ideas to the research rather than copying somebody's ideas, right? So we are going to, you have to be very careful with it. And then whatever intervention you're doing, whatever you're doing to your patients, whatever questions you're asking, you have to be very ethical about it. For example, even if you're not doing an intervention, it's just a very sensitive study, you might be asking about, something like their personal experiences, their addiction histories, or their sexual histories. You have to be very confidential about it. You have to give them privacy when you're asking these questions. And these are all the ethical issues which the ethical review board, ERC or ERB, would review. Then there are certain skills to learn when you are writing your own research. One is the referencing manager. So wherever you search literature, and Dr. Sadia is saying duplicating a study in another study is ethical, in another country is ethical. Not really, Sadia. Duplicating a study is not ethical, but doing the same study in your local setting, if that gives different results, might be ethical. But write it in your own words, come up with your own ideas, write in your own sort of work on it in your own methodology and other tools which you use, right? So don't just copy it. Then SPSS data entry, coding, recoding, computing variables. This is also something which you should learn so that you can analyze your data yourself. You can also take help from a biostatistician if you have one in your institution. If you don't have one, then you need to sort of attend workshops on SPSS and referencing manager so that you could reference your literature as well. Your introduction referencing, your discussion referencing should be through an Endnote manager. So this is how you reference your introductions and your discussions. You put numbers, and at the end of the manuscript or the protocol, there's a reference list where you tell the audiences what does the number mean and where have you sort of copied, or where have you taken that idea or from that or that previous research from. So this is the checklist of the research protocol. If you want, if you are in the process of writing it, you can just take a screenshot of it, or you can just take a picture of it and you can keep it with you so that, each one of these components you have to know in detail so that you could write your own research protocol. So this was just an overview and an introduction to research protocol writing. So anybody of you who's in the process can get some help from it. If you want to attend those workshops as well, as an Endnote, SPSS workshop, or if you want my feedback on each of your protocols, you could attend the research course, which is an online course. And what we do is that we take 12 online sessions on each of these topics. And then after each session, there is an assignment and a feedback. And at the end of the course, you're able to develop a protocol of your own, which you can sort of collect data and then go on to publication. So the whole point of this presentation was that you should learn And to learn, you have to respect, you have to enjoy yourself. Even if you're doing research, do it with excitement, enjoyment. If you don't, if you're not happy with what you're doing, if you don't enjoy what you're doing, you will not be able to give your best. And don't be worried about making mistakes, because making mistakes makes you learn. So just go on with whatever you intend to do. Keep on learning, keep on sort of making mistakes and correcting them, and inshallah you would be able to reach. I'm just telling you from how many countries and cities of Pakistan and elsewhere the today's audiences were from. And thank you very much for being so attentive, so interactive. I really enjoyed with you. The name of the plagiarism is the Turnitin. Besides Turnitin, there are other softwares available on Google as well, and you could just, they're just available and free for everybody to use, so you can use one of those as well. If you have any questions, you could ask me. This is just a few feedbacks from the previous students we had in the courses. And if you would like to join, then you could just, if you mentioned it in the registration form, or you have that number, you could just tell them if you would like to join the course. This is just the feedback of previous students. Any questions you have? Can I answer any questions anybody might have, which I can guide you? Can I guide you to anything else? Any other confusion? Thank you, Dr. Niamat. I hope, I'm sure most of you are junior faculty, or maybe you're master's students or fellowship or postgraduate trainees, and you're trying to struggle with your dissertations and your synopsis and your thesis, and maybe publication or two for your promotions. I hope you can make it. And Dr. Rahila, this is just a quantitative clinical research course. This is not directed towards a qualitative research, because qualitative research doesn't have analysis. It's just, you know, a write-up rather than any analysis. Yes, Dr. Amit, there'll be reading material and assessments. As I already told you, it would be based on assignments and feedback on assignments. So as you develop a question, I would give you a feedback on your question. As you write the methodology, I'm going to give you a feedback on methodology, and then when you're ready with your complete protocol, I'm going to grade that protocol and tell you how much you have achieved from this course. You're also going to get answers to the pre-test you have already filled up. So you're going to get answers to that and just see how many people have answered it correctly. Dr. Abdullah is saying that if you want to just begin with doing a study, I would say start with a cross-sectional study, and then you could choose other study designs. So whenever you start a study, it's better to start from a simple cross-sectional study, a survey, and then, you know, you could build up on other study designs. Right? Dr. Zakir, these are the numbers. If you want, you can just get more information from these numbers, and also you could email to us from the same email you were getting emails from about today's orientation session. That's askfaridah@gmail.com. I would be happy to guide you to develop your own protocols if you like to. We do have such free sessions off and on, and we are going to keep you updated about that as well. But if you want to join something, a formal course, then you can also do that. So thank you very much, everybody. It was an amazing session. Dr. Faiza, you can get all the details, and we do offer installments, as well as there is some discount for people who would want to join in groups as well. So please let us know if you would really like to do it. If you really like to do it, we're going to help you through any way we can. Right? So thank you very much, and very good evening. Allah Hafiz. Bye-bye.